compared to 2019. So, having mentioned what I saw with my brother, we are going to make sure that mental health for children, I'm going to say this is a lodestar for what those of us in public service have got to point to, is to improve and strengthen mental health services. Now, we've been able to make some gains. I was glad to play a role in the 988 suicide hotline, and I think that's going to make a difference. I'm especially proud to have written the new law that takes cahoots, which comes from right here in Lane County, national. All right? What I did is I looked and talked to folks at Cahoots, and I said, y'all have a wonderful program. It's paid for by the local police. Not going to be able to do that nationally. They all kind of looked kind of glum and, well, what are we going to do? And I said, how would you guys feel if, as chairman of the Senate Finance Committee, I put it in the Medicaid program? Because you guys have a multidisciplinary approach already. And everybody sure brightened up. And we got $1 billion, folks, that's with a B, this spring for my Cahoots law, which embeds this coalition between mental health and education and law enforcement in the Medicaid program. Let me tell you how it's going to work, because I think you want to start thinking about it already. Because Medicaid is a federal state program, the money will go to the state of Oregon. The state of Oregon will then work with local jurisdictions, local governmental bodies and schools and health officials, so that the money will come from the federal government to the state, because Medicaid is a federal state program. But it's going to all be based, what the state does, on applications and proposals from all of the folks at the local level. So I would really encourage all of you to start thinking, working with your health people and your law enforcement people, about what kinds of proposals you want to give the state, so that when the state goes for their portion of the $1 billion that's available, it'll make a difference. So, a couple of other points in the Congress. We're going to keep pushing for more money to train teachers and adults in the schools to detect mental health issues. More funding for recruiting individuals, particularly in low-income schools, and reaching out to the BIPOC community. And as I said, this is going to be something the Finance Committee that I chair does before the end of this year, is to advance a proposal that deals with these alarming kinds of trends. Now, here are some of the things that we're already hearing from the senators for you to think about. Behavioral health work shortage. Got to have folks in behavioral health. Doing a better job of integrating, and I heard the wraparound services already got mentioned. I'm all in on that. Something that I feel deeply about. I think the insurance companies are cutting corners on the parity laws. This is the law that says mental health is supposed to get treated like physical health. I think the insurance companies are stalling on paying bills. And to give you an idea, at the Oregon Health Sciences Center, they couldn't get bills paid for a long period of time. And then when I publicly said I was starting an investigation, they called me up laughing and said, all the bills got paid. There's got to be more to honoring the parity law than having the senator call up and say, you guys are, dawdling on it. And finally, at our hearing, and I think this will be particularly relevant in some of the rural parts of Lane County, is there's a lot of interest in telehealth and audio services, because they're concerned that broadband isn't going to be accessible soon enough. So that's the end of my speechifying. Let's go right to our speakers and just operate under the assumption this is the first of 2 sessions. You all are saying what, as educators and as health officials, you're going to do for students, and our next session will be with students. I'm going to invite some of you for that. Karen Gaffney, doing great work at Lane County Health and Human Services. Do I just give the microphone to people? Perfect. Sorry, Karen.
Well, thank you, Senator, very much for being here and convening us. And I know you've had a long-standing interest around behavioral health, and we've talked about youth mental health in particular. And as you know, we've had serious problems in Lane counties before the pandemic. And so we've been worried for quite some time. And as I look at our systems, I think the continuum is one of the important pieces. So I love the fact that you talk about our crisis services. We've worked with Cahoots for a long time and love their new Hoots that they've launched in the last few years that's specifically targeted for kids. I think that's an important part. And Ellen Thornton-Love next to me, who runs our child and adolescent behavioral program, she has her staff in our school-based health centers providing mental health services there. I think our partnerships with schools are really important to go where kids are. I worry about anxiety and depression that's increased the last year and a half in particular, as our kids go back to school, but also as the year progresses. And we have kids who are needing to quarantine, their teachers are needing to quarantine. So I think that from Lane County's perspective, we focus always on prevention. So what can we do for families to be able to keep their kids healthy and skill them up? We have a number of programs that are universally available in the community with tools for parents to be able to use and online, and that works great for some families. And then we need to make sure we're tending to that whole continuum along the way. Ellen and I were talking before about gaps in our services here in the community. We don't have any acute care beds for kids in our community. No, and so we have kids who are in the emergency department. They go to the emergency room, and then either, if there's a bed in Portland, they go to Portland or they go home. And those are the families who then are really concerned, because just like the Wyden family, they're worried about their kids at night. So we have some gaps in our system that we have to fill. And I'm looking forward to more federal partnership and figuring out how do we build those the services so we have that whole continuum to support kids, whatever their level of need is. And the Medicaid program is important to us, so we're certainly a partner with the schools, with our nonprofits in the community, with the state and federal government and our federally qualified health center to make sure that we're leveraging those federal dollars that are available to get kids the services that they need.
Well, I always say at these meetings, you got to under-promise and be useful. I'm going to start going after this acute bed shortage immediately, okay? And we'll be working very closely with you. That's just fundamentally unacceptable.
Okay. No, I appreciate that.
Right.
That, and thank you for the workforce piece, because that's critical for us in all parts of healthcare, but in behavioral health in particular. And again, while we certainly need psychiatrists, we need that whole continuum. Right. We need peers, we need mental health associates, therapists all the way through. So thank you for your support on that.
Ellen, well said.
Yeah, so that is what Karen and I talked about. And I also would like to thank you for being here today, because I think this is a critical moment for our community, so thank you. The workforce piece, I think, is critical right now. I have been thinking about ways to promote that. I think we need to incentivize students who are in college and make it a viable career for them by having things like tuition reimbursement. It costs a lot of money to become a mental health professional, and the pay does not allow them to have the ability to live comfortably. They struggle to pay those loans. I also think we have health programs and science programs in high schools. I would love to see it if we had a mental health career opportunity and support youth in gaining that experience, being able to maybe work with peers, doing programs to support mental health education as just as big a part of our science and health curriculum as our medical and science nursing programs are. I just think it's critical right now for people to understand the importance. There is a place where they meet together. We understand that the brain is impacted by mental health and the stressors in their community, and so separating them out does not make sense to me. I think it will also give us a more integrated approach to treatment.
Ellen, do you get the sense that a fair number of students are interested in careers in healthcare?
Yes, I do. We talk to them all the time. I know we have a program here. I actually have been talking to students that use our services that are interested in the healthcare field, and they would love to be part of some kind of board or listening sessions to let people know what they think that youth need that can support them, and also what can support them in those kind of careers.
Let me tell you what I'm looking at, and this will be another area we'll want to work with you on, is if we could find a way to have some healthcare internships where you have students in a position to learn in various health settings without running up against all the bureaucratic requirements with respect to licensure for this and licensure for that. I've gotten a pretty good reaction from students talking to them about it and practitioners. So this is another area we're going to look at, because I get the sense that a lot of students, if they could kind of, just have a chance to see a little bit more about what the healthcare field was about, would be attracted to it and be one way to deal with the workforce.
I think that would certainly help.
Good, very good. Sydney.
If I could, I'd like to add, Kat.
Wait a minute.
Oh,
Sorry.
you already talked to
Excuse
me.
my bad manners. Would you like to add anything?
Well, I was just going to say that I have our board chair, and she has some remarks, and if we have time, I have 3 people who are prepared with anything that you'd like more information on. So
let's like they say in the Senate, let's let the superintendent yield to the people she thinks can make a difference.
I would like to yield to the board chair, and then we do have 4 people in this room that know a lot about what's happening at the schools.
Perfect.
Hi, Senator Wyden, thank you for being here. I'm Judy Newman, and I'm the chair of the 4J School Board, and I'm really happy to be here. This is not my area of expertise. Where I work is in early learning, and I just want to highlight that, first of all, I think these proposals are extremely important, especially workforce and the integration. I also chair the system of care for our local CCOs. And I see we get barriers because it's the executive team. And there's so many barriers we can't break down. And those barriers really have to do with integration. So when we try to integrate services with mental health and education, it sounds good and you can co-locate, but there's a whole lot of issues with funding and how we get kids into programs. So I'm really happy we're going to focus on that, because there's a whole lot of work we can do in there. And I don't want you to leave out the little ones. You know, there's a lot of research on toxic stress, and we're seeing this play out in classrooms, not only in pre-K classrooms, but in the early elementary years. And so when I think about funding, I think, the CAHOOTS, we want to do more in our schools. We've done some pilots called HOOTS, but I would like to also see more in the prevention area where teaching social emotional, if we don't start early and there aren't funding sources for that, it's really hard to get Medicaid, to actually fund those things like groups and getting the basic skills, which I think will really pay off over the long run. So, thank you for being here and for supporting our kids, and that's what I wanted to add.
Thank you also for speaking up for those really young ones. I just heard from a parent who has a 9-year-old, and the 9-year-old just faced a tremendous set of mental health challenges and anxieties, and this person left their job. The whole family has been working on it. I think you understand how devastating this is. This person not 3,000 miles away in Lane County.
I know a lot of those people.
It's nice to meet you, Senator. My name is Misael Flores Gutierrez. I am a Director of Equity, Inclusion, and Instruction. And I thought I'd take just a couple minutes. You spoke a little bit about the wraparound program. And we have grown it. I think it was 2019 into that school year when schools transitioned to online learning, we really responded as a district, and we initially started out by providing families with food and supplies at ATA Middle School, and we grew from there. We added one district social worker to help with a bilingual district social worker to help with mental health, counseling, and outreach for families, and then we also added 2 bilingual cultural navigators. That was last year. This year we added 3 more district social workers, and we're in the process of hiring 1 mental health specialist, which we're really excited about that. We also hired a supervisor to grow the wraparound program, and we don't officially have a name for it, but we're going to start with, lack of a better word, a Fortune Welcoming Family Center. We have a space for that, a welcoming center, where families can come. It's middle, kind of central school district, and families can come there for different types of services. So that is in the works this year. And we're really transitioning to create a more sustainable model to help better support students, families, especially with mental health, anxiety, depression. That is really our focus this year.
Very good. Okay, Sydney, who else for part of this?
We'll just keep going down the line. Yeah, hi, Senator Wyden. I'm Kat Lang. I'm the Student Services Director, so my job encompasses quite a bit. I work very closely with Misael and his department. So I'll talk a little bit about what we have done over the past 2 years, and then some things that I think, and piggybacking on some things some other people have said that I think we need to improve on, and things that we need to expand on. So as was mentioned before, I think prevention is our big focus, and starting young, and really looking at students with mental health concerns or trauma backgrounds at a very young age, and starting to really focus on that prevention is important. So to do that, we have, with our student investment account funds, we did increase our school psychology group, hired 4 new school psychologists who do play a very important part in buildings around mental health and students with trauma, or just not getting along with other people at school, bullying, all the kind of stuff. So that was a wonderful opportunity to increase some of that staffing. And then we also created 2 positions, a suicide prevention coordinator who finished up our Senate Bill 52 suicide prevention plan and tightened that up and got that all done, which was a huge accomplishment for us and that we needed to get done. So, and then we also have a threat assessment specialist who we used to always coordinate with the Child Center actually to do our threat assessments. And so for students who were a threat to themselves or others or having some safety concerns, we always went out and contracted out. We brought someone into the district to do that. So it's a faster turnaround time. It's people who actually know the student, and there's more of that one-on-one connection. So these are all positions that we've created to try to tighten up our systems a little bit and make sure that we're having a quicker response time to our students who are in crisis. So we also increased our nurses and have more nurse staff than we've ever had before, which is also helpful because nurses sometimes are the first line of defense. If kids come in with psychosomatic symptoms, I don't feel good, I don't want to go to school today, I have a headache. So having our nurses kind of have an eye on those kids is a bit important. And then I know that Misael mentioned that we're trying to hire a mental health person to kind of help bridge the gap between when we know that a student is in crisis, and sometimes services in the community there's a lag, and sometimes it's months, 6 weeks up to sometimes a couple of months before we can connect those families with some consistent outside care. So we're looking to hire a mental health professional to actually come in and provide that level of care. Because although our school counselors and our nurses and our school psychologists and all these other people are wonderful, that's not their training, that's not their background, so we really need somebody who has that real intensive mental health background experience. So we are looking to bring that position in. We also use our resources in the community a lot, Cahoots and Roseburg Therapy, Peace Health. We have all kinds of outside resources that we contract with to actually help provide some services and come in and help us with students who are experiencing all kinds of mental health crises. And then we also have been tightening up, we have so much going on. We tighten up our social emotional learning and really making it a part of what we do every day, focusing on care and connection of kids and families, so that we're all using the same language and we're learning the same skills and we're actually practicing just kindness and gratitude and patience and all that every day in school. And it's not just all about academics, it's about the social emotional piece as well. And care and connection is one of our top focuses for, especially this year coming back after COVID and some kids who haven't been in school for a very long time. So going from that with our prevention focus, we also, I forgot about this, we also have a screening tool that we piloted last year when we went back to hybrid, and it's called SABRE. And I can't tell you exactly what it means because I can't remember all the acronym, but it's a social emotional rating scale that all the teachers will be giving this fall. And we give it 3 times a year, or you can give it up to 3 times a year. And it really is just a screening that shows if there's any students who might have some red flags for some social emotional things that they're maybe not even outwardly displaying at that moment in time, but when they have something in front of them that they can answer, it gives us a little bit of insight into what's happening in their heart that they might not be showing outwardly. And then we are working on some interventions and some prevention kind of strategies with our school psychologists and our behavior consultants around what to do if there's some red flags with those with that rating scale. So that's been a huge lift, and we're super excited that we piloted 3 schools last year, and now all of our schools will have it this fall. So really excited about that. But talking about shortage of staff, shortage of beds, shortage of mental health professionals in the community to help families, that's where the real crisis is, because we can do a certain level in schools and we can help support as much as we can, but it's really that outside of school, like connecting those families with mental health and supports, or having a bed for a student who's in acute crisis, and not having that is really hard. Because those kids come back to us, and we're really trying to focus on what does that step-down plan look like for a kid who has been in an acute crisis, what's our role, what's our responsibility, and how do we have the staffing to help support that as well.
You're finding that kids with an acute crisis, because there aren't the beds, just keep coming back.
They're right back in school, sometimes the next day.
Again. Pardon me, the next day?
Sometimes within 24 hours, yeah.
So a kid could come, conceivably, you educate me on this point, has an acute crisis, goes to an emergency room, and then possibly comes back to you within the next 24, 36 hours.
Yeah. Just because there's nowhere for them to go.
Or they stay at the ER for a day or 2, and then they come back to you. Is that?
Yes. Yeah.
Longer than that. Okay.
Yeah, and I know some of the families who come back to us say that they didn't want to keep them in the ER or whatever, because it's just such a crazy situation. So they'll come back to school. So we need to tighten up what that looks like for us as well.
It would be fair for me to say, and I'm just, at the end, what I always like to do is, I like to say to people at home, so, tell me what you would say if you were the chairman of the finance committee. And I think what I just heard is the absence of acute care beds ripples all the way through the community in terms of longer emergency stays, probably back into the home where there are problems. I'm going to ask some questions about that. And then they come back to you again. Democrats and Republicans in the Senate Committee hear the story of Churchill. I pledge to you on acute beds. Okay?
Awesome. Okay, and I think that's about it in my department, or almost it. So I'll pass it on to, here's Joy Maxwell. She's our lead nurse in the district. So.
Okay.
Hey there, welcome. I think Kat said much of what I would repeat actually, and that is the absence of acute care. And as a school nurse for several years in the district, I've also seen students who come through the door and they're back the next day. They
Right.
tell me, what their experience was overnight, and it just isn't that helpful for them. They're back again, and in my role as a school nurse, I would refer them, but if there's nothing productive at the end of a referral, it feels very empty to make referrals that don't go anywhere.
Yeah.
So, in addition to the lack of acute beds for longer term care, there's really just not a lot of immediate crisis care. I love Cahoots and Hoots. They've been at our high schools. I've been a nurse at the elementary, middle, and high school level, and I see it throughout every grade level. I think that's important to remember. I think maybe more focus in a younger grade group with prevention, so we don't get to high school and have a panic attack when things, get scary. I've been in a high school when somebody pops the homecoming balloons and kids are dropping on the floor with panic attacks. 5 at a time, spread out across.
And how old are these kids who drop on the floor when a balloon pops?
High schoolers.
High school.
Yep. And I've had those experiences, and so I really do understand that there's a level of anxiety and depression that I, as a nurse, haven't seen in a pretty long career in nursing. So to me, that is, we can be hopeful in the moment, but we're school nurses, we're not necessarily, mental health care professionals as such. And
So when you started your profession, Joy,
yes,
you didn't see kids dropping to the floor when balloons went off.
it was rare, very rare. And in 28 plus years, it's the speed in which that is increasing is alarming to me.
I got the drift.
Yeah. So the referral system, we are building great things and referral systems and doing everything we can at the school-based level, but I feel like that these students need a place to go after the referral, and that would be the main point I'd like to make today.
So, Sydney, we got a little out of whack for my cheat sheet. Would you like to just call on the remainder of our speakers? Mr. Gutierrez spoke very eloquently. He was in my list. So, and I also, before we wrap up, I want to take special note of the fact that Heather Buck just constantly stands up for the county on these kinds of people issues. I went to school to play basketball. I said, some people come to play every day. That is your county commissioner. So Sydney, who would you like to recognize? Then we're going to finish with the speakers that Sydney would like to have talk, and then anyone else who chooses to, and we'll let Heather make whatever comments she wants. And then I have some questions for all of you.
So Director Brooke Wagner is to my right, and she is going to round out what they didn't say or that she thinks that maybe she can add to it.
Hi, Senator Wyden. Thank you for being here. It's fun to be here because I was a student at Churchill, and I spent most of my career in Lane County as an student and an educator. I wanted to share with what Misael, Kat, and Joy shared about the additional resources. We wouldn't be able to add those positions if the state legislators did not pass the student investment account. All of those positions they mentioned come straight from that funding source. That wasn't part of our general fund, that was additional money that came in. So I want to be appreciative to our legislators who worked hard to pass that.
Good.
Because all those additional resources came from there. The other piece I wanted to mention a little bit about our prevention is we use a question, persuade, and refer with our suicide prevention that we've been able to train all of our counselors and our nurses and our school sites when they come across a student who might be in having some suicide ideation. And so it's a system that we're implementing district-wide, and we will implement that to our teachers and to our support staff. So I bring that up because of an additional example of prevention. And just to reiterate what staff has already shared, that when we have a student who's been in a 72-hour hold, and we want to get them on a list to get mental health services, we're using our funds to create, like our tier 3 students, our critically students that are just, when I say tier 3, real top of the triangle, who are in crisis mode at that moment, because we don't have any county services that can address them right away. So we're using the addition to the RAP services team that will have the social workers in every region in our district and a mental health specialist who can really handle just that tip of the triangle kids. So, and I also wanted to share with you that at the high school we have career technical programs, and we do have a health occupations program that at our high schools throughout the city, and that's actually a statewide program. One of the focuses of a health oc program sometimes is really more focused on nursing and medical, and I think as a state we can do a better job of expanding our health occupations programs.
I'll encourage people to follow up on what your occupation program consists of.
Yeah,
That's very helpful.
because that mental health piece would be an avenue within our health occupations programs that our career technical programs have. So, anyway, and I was the health oc teacher there at many years ago, so that's why I know.
And she's actually an assistant superintendent, not a director. So I think in the presence of royalty, messed up. So I just feel like I should give her her due.
Hey, you over there.
So I believe that's everyone that we brought to share with you today.
Let's have Heather and then have a couple questions and we'll wrap up. That's great.
Thank you, Senators, for making it a priority of coming to Lane to talk about this. It's very challenging here at the county to figure out where to find those funding streams to keep these supports going. As a mother of an incoming second grader in a rural community, I have a keen eye on how we get these services out to our rural small towns and unincorporated areas. We want to make sure that everybody in the county is able to access the resources that do come our way, and we don't have this perpetuating system where they at a young age can't verbalize what's going on and explain it or understand it, and it comes to an age where they meet these programs here in high school and for some reason they miss out on whatever program might be coming to them, or we have these gaps and they fall through. They end up adults on our streets and our unsheltered systems that also don't have the means in which to help them succeed or manage whatever mental health issues that they're having. And they're seeing this very much so in our rural communities as well. And in our rural communities, they really don't have any resources as to figure out how to serve them. So whatever I can do to be helpful in order to support you in your efforts, I will do so, and it's my job as county commissioner to ensure that I can help bring those resources home from the federal government to our county here and be able to share and support with our staff the implementation process. So thank you again for just making this a priority.
Well, thank you, Heather. And Senator Crapo is from rural Idaho, and he and I have already said we're making that a priority, this bipartisan bill. Let me ask a couple of quick questions, and then we can wrap up, because I know we said it wouldn't take more than an hour. What did you find was the experience with kids having difficulties learning at home? Because we know that during the pandemic year, we have kids who have difficulty getting good connections, parents, and any lessons there in terms of mental health and learning at home? Yes, go ahead.
So what we saw was we were working really hard with the schools, trying to get people technology that completely lacked it. We did work with the system of care. Very young children whose parents have to work, not being able to support. Maybe they themselves have learning difficulties. Trying to teach children to read that had challenges was extremely difficult. People who had aids, maybe for their child that had more serious developmental and neurological issues, could not get the help they needed. They weren't allowed to have people in their home anymore. It added a tremendous amount of stress. For families where maybe multiple adults have to work, their kids literally just had to kind of try to figure it out on their own, and I think kids stopped attending school, particularly those that had difficulty with maintaining attendance. They may have had their computer on, but they were not attending the schoolwork. And what I've heard from a lot of kids, both young children, grade school age, we serve from littles, like 0 to 21 in my program, have said that their parents are worried about them missing those key really early learning skills, which we know are easier the younger a child is to maintain those. With the middle and high school kids, they're worried that they did not obtain enough skills to be able to really move on in their grade, yet they're moving on in their grade, and they're really scared about, like, if a kid that's going into algebra for the first time, well, I've never mastered my math last year, so what am I supposed to do? And then with our teens that are getting ready, maybe it's their senior and junior year, they're scared that they miss so much that even if they do okay and pass, that they will fail in college. I mean, these are really anxieties that they have.
Stemming the combination of mental health challenges
Yes.
and difficulties
Both together.
is a dangerous mix.
Yes, and just being really scared about what the future holds. I mean, there was huge things that happened in our community, not just with COVID. The racial protests made our clients of color, at least the ones we work directly, as well as what we've heard in the community from parents, scared about what would happen to them in the community. They've been attacked racially. We have Asian families that we work with who have been verbally called out just trying to eat dinner, where people approached them and told them it was their fault that COVID was here. These are real issues that affect people's mental health, and I think if we move forward with equity, we really need to think about the pressures that children of color or minority populations experience. I think it is a problem in Lane County, which is still vastly majority of white people, and the history that we have here needs to be recognized. And so I think all of those are real challenges as we go forward. I would love it if even from a young age, there was like a mental health check-in every day, a talk about what it means to have anxiety. What does that look like? Adults have anxiety all the time too. What are ways to manage anxiety? I think if we do that from a very early age, we know that if people have emotional intelligence, that they can actually cope with things that are pretty stressful easier than those who lack it or lack the ability to talk about
I
it.
almost took my last point out, but one last question. So the theme of this bipartisan bill is going to be for getting mental health care services when they are needed. And I gather from all of you, starting with the lack of acute beds, a substantial fraction of kids in Lane County aren't getting the mental health care services they need when they need them. Is that a fair appraisal? Apropos of Ellen's last point, you call it a check-in, whatever way you might want to describe it. I think what I've heard over the last hour is that what we're dealing with has a snowball effect. And if it's possible to catch kids at the top of the mountain before they free fall into a mental health crisis where they need an acute care bed, the odds are better for success. And what you're telling me is that people who have election certificates need to help up front, help at the start, because if you can get help for kids and families and educators who are serving underserved communities, then the challenges aren't as likely to snowball into those big problems with acute care beds. Is that a marginally coherent summary? Let's give the last word to Sydney. She's your superintendent. By the way, I'm going to stick around and be available to answer questions, but I told everybody we stay Last word, City Superintendent.
Thank you. So I do want to second what Brooke Wagner said about using our SIA dollars wisely and thanking everyone who made that possible to give us extra support. And then what board chair also said was that we need to start early. So sometimes when a kiddo gets to high school and that balloon pop is that's not what started it, right? So starting early and with the work that Judy and her group does is important, and then trying to catch it early. So we are trying to find a mental health therapist that we can hire, and yet there are very few of them to hire. So we are looking for one, and we probably need 12. Yes.
With students who are just coming out of maybe a 72-hour hold, we really need, and our idea is that we bridge them with mental health support until we can get them to a place where they can have maybe comprehensive care.
That was to me what the lesson was in the last acute care beds ripples all the way through the community.
Yeah.
Just highlighted the mental health therapist.
Yep.
Okay.
So the money is important, and we're using it.
This has been a great start as say that we have begun the hearing process with Democrats and Republicans united